Hello, everyone. Thank you so much for your love, affection, and enthusiasm towards my podcast. You all know that I have started this initiative of discussing very valuable content in my podcast, especially related to health, education, and lifestyle. So, in this context, I want to discuss today about a very important topic that is all about insulin injection. So, we all know that. India is the diabetes global topmost country. In this aspect, I want to tell you that most of the people are taking insulin injection. They are doing it on their own. They are self administering it. Even globally, also, as per my statistics, there are around 75 to 100 million people who are taking this insulin injection, doing it on their own. But I got a thought in my mind. So this is an injection. It should be done with a careful supervision. Generally, if we go to hospital, either the injection is done by an experienced doctor or a nurse. But here, the challenge is that the caretaker or the concerned person is taking the injection on their own. So we are safeguarding the injection. We are taking all the careful precautions to protect the injection. So we are only doing everything. Now, in this challenge situation, are we doing the things in the right manner? Are we following the guidelines? Are we following the correct path of implementing the task? So that is what is today's discussion. And luckily, we have an expert, Dr. Manthan Mehta, who has graciously accepted my invitation, being so busy with his daily tasks and looking after his patients. Gave us his valuable time to mainly explore these particular aspects. And I really want to tell you all that. And I'm very proud about this point that I think this is the India's first podcast about this insulin injection related task and how to do it in the best possible manner. So, not wasting your valuable time, I want to discuss on these pointers. But before that, I want to tell you that if you have a concerned person in your home who is taking this insulin injection, and if you are also responsible for doing this task, please go through this entire episode and do like it, share it, comment on it. It will be very valuable for us for the future episodes. So, Dr. Mehta is an expert doctor and he has done his MD and MBBS. He is very much experienced with this particular topic. So, he is going to discuss about all these concepts. So, Dr. Mehta, thank you so much for sparing your valuable time and joining this podcast. And I request you to kindly introduce yourself to my audience.
Sure, Dr. Rajesh. I think before I begin with my introduction, this is a very noble cause that you are doing in terms of educating patients. And as doctors, sometimes I'll take it we are guilty as charged because of very busy practice in India, where you're not able to give too much time to your patients, and all these finer aspects of treatment get missed. And in the chronic care journey, we say that only 10% work happens in the clinic. Rest everything the patient is ideally doing at home and is on their own. So initiatives like these, help us reach more and more patients who will actually learn and know about it. So a little bit about me. Like Dr. Rajesh said, I'm a physician by training, spent a large amount of time in diabetes, and worked on various aspects of diabetes, from practice to launching drugs in diabetes, to launching digital programs in diabetes, and launching patient education materials and programs there. So these topics are really close to my heart, and I always believe that educating the patient is a very critical step in managing any disease, particularly chronic asymptomatic diseases like diabetes, where you don't see what's going wrong until you get a test or you get a complication. So, with that, back to you, Dr. Rajesh.
Yeah, thank you so much, Dr. Manthan. So, in this context, I wanted to know what are the different types of insulin injection, Dr. Manthan?
Right.
In general.
So, when we talk of insulin injections, let's divide it into two different parts. Yeah. One is the way you get the injection. So, one is, you get those syringes, which you typically see with the red cap and the thin pencil like syringes with numbers written from 10 to 100. That is a syringe that you get. Right. Then these days, you also get pens. Those pens have pre filled with insulin. You put a dose that the doctor tells you with those units, and you just inject yourself with that pen. The third one are insulin pumps. Now, this is typically used in patients with type 1 diabetes, which means these are patients who have to live um, with additional insulin for most probably the rest of their lives. So, for those kind of patients, insulin pumps are also available. So, that becomes those type. Now, within those types, there are different types of insulins, which are rapid acting insulins, which act, and they are all based on the time or onset of action, right? So sometimes people feel uh, why there are so many different types of insulin, and insulin is just insulin, but that's absolutely not the case. There are many different types of insulin, and if we have to divide them, again, they are mostly divided based on the time in which their action starts, and it is also based on the time for which it peaks, right? So for example, you have rapid acting insulin, which means it will kick in very quickly, like say 10 to 15 minutes, right? And the effect will wear off in 4 to 5 hours. And typically, these injections are taken just before their meals. So, when patients discuss, and these days there is a lot of discussion happening on WhatsApp groups or during when they meet for family outings as well, because we know 1 in 10 Indian is a diabetic. So, people are going to talk about it and then say, no, why do you take insulin just before meals? I take my insulin much later. But that is because they are all on different types of insulin, right? So if you are on a rapid acting, that's where you take it. Some examples are Lispro, Aspart. I'm not going to name brands, but these are the content in it, right? Then there are short acting insulins, wherein the effect starts in 30 to 60 minutes. It will usually peak between 2 to 4 hours, and the effect lasts for 6 to 8 hours. Now, this is your classic regular insulin. So, any regular insulin is generally taken this way. So, this is, we call it very old school insulin, where they are short acting, and this is traditionally how insulin used to be taken. Now you also these days have intermediate acting insulins, which means it takes somewhere between 1 to 2 hours to start its action, peaks around 6 to 8 hours, and the effects last up to 12 to 18 hours. So sometimes people say that, oh, I take insulin only probably say once in a day, whereas some people are taking insulin 3 times a day. It doesn't mean that your diabetes is probably higher or lower. That could be one of the elements, but it could also mean that you are prescribed a different type of insulin, which is an immediate acting insulin. One example of this is the NPH type of insulin, very, very commonly used. Yeah. Then there is a long acting insulin. Here, what happens is there is the action starts in 1 to 2 hours, but there is no peak. It's generally flat and steady. The effect lasts for 24 hours or more. So patients again take it typically just once a day, and these are newer insulins. Glargine is very, very commonly used in India, and this is generally a background insulin that most people are using today. Sometimes you are given a mix of a basal bolus regimen, as we call it, where you take a short acting insulin first and then you take an intermediate acting. Now, there are also newer insulins which are ultra long acting insulins, which means the duration will last up to 42 hours, right? And one example is Degludec. This is generally given to patients who forget taking insulin every day or don't want to take it every day, or depending on their preferences in terms of compliance, complications, meal, travel, etc. Right? then you also now get pre-mixed insulin. Again, this is, I think, the second most common type of insulin being prescribed, which is like a fixed combination, which has two types of insulin: a short-acting insulin and an intermediate insulin. So consider it like a two-in-one convenience. And this generally comes in a 30-70 kind of a mix. Again, it's great for simplicity, but sometimes doesn't allow us to flexibly change or taper your dose. So these are the broad ways in which I think insulin injections are there. So when you talk of injections, they could again be either syringes, pens, or pump, or they could be based on the way they are acting: short, long, ultra short, intermediate, mix, etc.
So, in this context, Dr. Manthan, I wanted to know why it is important to know the correct procedure of insulin injection, especially for type 2 diabetes
Right,
patients.
right, right. I think very critical because, like I also tell patients that it's not a pill that you pop and forget about it, right? Generally, people want that quick fix that you take a simple pill and it works. Insulin is a precision hormone that you're actually taking. And why it is so important is because one is type 2 diabetes patients are self administering this at home, and how and where you inject affects how it actually works and how much of it will actually go into a bloodstream. For example, if you inject too shallow, that means you are just touching. Some patients are very scared of pricking themselves and they just touch the skin and think it has injected. It will not work properly. You will probably think, and you go back to your doctor and say that, oh, I'm taking my insulin regularly, and the doctor sees that there is no effect, the blood sugars have not changed, but you have not probably mentioned that you are not pricking to in the right way. Or sometimes you are injecting too deep, and this again is dangerous because if you go too deep, it may hit your muscles, right? And insulin will get absorbed very quickly from your muscle, and I am one, and you might land up with low blood sugars. So it's important to know because you have to do it right enough to stay safe and stable. uh, Generally, when injections are given, you do it in clinic, the nurse is giving you or the doctor is giving you, so they are verifying. There is a checklist which is there in their head that, oh, I have to check for this, I have to check for these things, and then I'm administering, and this is the way I'm administering, because they are taught with years of practice and precision. When you're doing it at home, a large number of patients who administer insulin at home are elderly. So either they don't know the right way, or they are dependent on a caregiver who is giving it for them. They don't are not explained in detail sometimes in the clinic. We try to give them video links, or we try to give them pamphlets to explain how you should actually give it, but they probably refer to it for a couple of days and then still miss a lot of nuances. So it's very, very critical because as dangerous as what diabetes is, hypoglycemia, which is a complication if you get overdosed on insulin, can sometimes be really fatal. So and vice versa, if you are thinking you are administering insulin every day but it's not going in your bloodstream, the doctor will keep increasing the dose or change the therapy, keep administering it, and you will still not see effects and eventually land up with a complication of diabetes.
Well said, Dr. Manthan. And in this context, I wanted to know, like, what is the correct temperature to store the insulin injection?
Right. To a lot of patients who are enthusiastic about cooking, I give them an example of paneer. So, paneer or cottage cheese is very unique in a way that, if you heat it too much, it gets burnt very quickly. And if you freeze it, it loses, its taste or everything. You cannot do either. So, similarly with insulin, it is something to be refrigerated. Now, when I say it is to be refrigerated, the standard pack generally says, you store it at 2 to 8 degrees centigrade. When you refrigerate also, a good practice would be to keep it in your refrigeration shelf, not on the one which when you open the fridge, on the door there are shelves. So you keep it at the door generally, and that shelf instead of keeping in the main shelf, right? So because the cooling differs on both sides, the risk of cooling getting lower. Most refrigerators, if you ever get a chance to see, they come with temperature things now. We'll see that the refrigerator has a temperature of generally around 4 degrees. You try to keep it in that temperature range. So it's best to keep it in the fridge for 2 to 8 degrees. Now then the question arises that when you open it, can you keep it outside? What if you forget keeping in the fridge today, or you are traveling, there's no fridge, what do you do? So generally the way insulins are made, they're stable even at 25 degrees, so they're stable at room temperature. Now in peak summer in India, we have temperatures which go very very high, so there are chances that it, according to the label, it may not stay good or stay safe, but you can keep it outside in moderate temperatures around 25 to 28 degrees, and that way it can stay good for up to 4 weeks, so roughly say 28 days. But again, you should not, if you're keeping it, don't keep it very close to your gas, or the shelf above the gas. If you're traveling, don't keep it in the dashboard of the car, or don't keep it in places which are going to generate heat at some point or the other. So small little nuances, but very important. It is written keep it refrigerated, but then people have all these kind of questions: where in the fridge should you keep it? If you take it out, what happens? If you forget keeping it back in the fridge, then what happens? So some small things that they can do.
So doctor, here I wanted to know, after opening an insulin vial or pen,
Mhm.
how long can it be safely used, and does its storage requirement change?
Right. So, just in continuation to what we discussed, right? So, once you open it, most vials or pens are good for about 28 days. Yeah. Regardless of whether you're storing them in the fridge or sometimes outside. Like I said, at room temperature, also we can do that. After that, and please, you're going to, some people are not going to like it, but after that, even if some insulin is left, please throw it away. Okay. Because if you keep it after that, we do not guarantee whether it will stay. Not very little is left. Generally, the dosing is done in a way that very little will be left. So, maybe with a heavy heart, just throw it away. Don't use it after 4 weeks, for your own safety. This is about your health, and a little bit of it will generally be okay. Two, there are specific timelines for long-acting insulins as well. So, with your insulin, generally you get a package insert, very small font, very small things, difficult to read maybe for sometimes, but use the help of younger ones who may have a better eyesight, and just understand what the requirements are and what its shelf life is. With the new long acting, ultra long acting insulins, the shelf life has also changed, right? Because now you're giving it once in 2 days, once in 4 days, etc. So they are all prepared in different ways, and because of the preparation, the shelf life may vary. But what I'm saying is, for generally for all insulins clubbed, it is generally around 4 weeks. But for certain insulins, they may have a longer shelf life, and they are of course the expensive ones, so I'm sure you're not going to throw them away.
So while explaining the types of insulin injection, you already told about the types of insulin injection.
Right.
So what do you suggest? Which is the best way to do
Yes.
insulin injection, and what is the simplest way? What do you suggest?
Correct. So I'm going to, explain probably all three in very short. That syringes, old school, we've been learning, we've been taught that way, very cheap, but needs a little more skill. So if you're starting out, it may sometimes need some skill. Pens, I think, are the most beginner friendly ones. So people who are just being shifted to insulin, or being doing given a trial of insulin for some weeks, I generally prefer giving them pens, because they are portable, they are accurate, and they are less painful, because you are able to titrate the dose. You don't have to really pull this way and see, okay, 10 units, 20 units. You are able, it's like a dialer. You are able to check those donation things with clicks, so it's easier, right? So that's how we generally do it. Pens generally win for what currently it is, because of convenience, because of its portability. You don't have to think too much, and it seems little a bit of an upgrade, right? Of course, pumps, if type 1 people are using it, needs continuous infusion, and it's something that's expensive, needs monitoring, but beneficial for those patients. Between syringes and pens, cost is a big factor. If you want something cheap, then syringes are more affordable, of course. Pens, because of the technology, are a little more expensive, but more convenient, more accurate in many ways.
So, Dr. Manthan, here I wanted to know what parts of body should we inject the insulin injection?
Right.
Is it required to rotate those locations?
Absolutely. So I think when we do sites, we generally I say it is BTU in that order. B is your belly. It's the most recommended site for every patient. I say use your belly only, but T and U if somebody else uses it's fine. So belly, where do you use it? So you generally we all have a navel, right? And you generally take 2 inches away from your navel. So you inject 2 inches away from your navel. You have more peripheral surface, and unfortunately, most diabetics have good amount of belly fat, or we as thin fat Indians have a good belly, and it gives you a lot of surface area to do it. And rotation, of course, is very important. And the belly gives you an option to rotate because the surface area is quite big. So you just have to be careful that it's 2 inches away from the navel. It's also less painful when you inject in the belly. Less chances of it going into the muscle as well. And when you pinch it and do it, even it will always go beyond the skin as well. So your depth of insulin injection is always better. Some people are not able to do it in the belly, and for them, I recommend you do it in the thighs. Or if there are caregivers who are able to give it in the buttocks, you can do it as well. The bit of a problem there is that the absorption is relatively slower compared to how it would happen from the belly. But again, safer sites, more surface area. So broadly, when we talk about these things, we're talking more of surface area where you can inject. Now you have a big tummy, you are able to put in a small needle anywhere and it won't even hurt you. Inner thigh sometimes hurts people. Buttocks, of course, self administration is very, very difficult. So, not usually recommended for self administers. Then comes the upper arms. Now, when you do it in the upper arms, you ideally do it somewhere in between. Now, for people who are self administered, they don't understand the muscle anatomy or don't understand where insertion of muscles are or where the nerves are going or where, blood vessels are flowing. So, generally, you do it in the middle part. Again, the middle part gives you a lot of surface area here in your upper arms, and it's like a thing which you can inject on this side, right? So that again you can do, but the preference order, like I said, is always BTU. It's always the belly. Thighs, for again its simplicity, that absorption is relatively slower but more surface area. Now, why you keep rotating your sides? Now, there is a common side effect of insulin called as lipodystrophy, right, where the fat gets rearranged when you keep injecting at the same site. Commonly also sometimes called as insulin lumps. Patients generally come and say that, oh, I've got this here in my belly, or I've got this in my thigh. Or they go to a dermatologist and say, oh, what are these lumps that I'm getting in my thigh or I'm getting on my belly? And that is happening because you're not rotating your insulin sites very commonly, right? So these are all fatty lumps. And what will happen is your absorption gets delayed. And it is not just delayed, sometimes it is a messy absorption. Okay, it may if it gets injected in the lump, then the absorption is delayed significantly. If it's getting injected in the hollow part around it, the absorption is suddenly faster. So you don't want to take those kind of chances, because if you keep doing it to the same spot, you have a chance that your sugars will start getting unstable, and you don't want that. So the purpose is not solved. Keep rotating your sites. Generally every 2 days you can rotate. Some patients do a weekly rotation, that okay, 1 week they do the right side of the belly, 1 week they do left side of the belly, then they go to the thighs, and then they go to the arms, and then they start that cycle again. So see what works for you in whatever way, but please keep rotating your site. Some people change the site every day, like they do right left. And something in the belly you might not even remember sometimes where you've done it. So keep doing that, it's fine.
So here I have a doubt, Dr.
Yeah.
Manthan. There is always a chance of blood, small blood, to come out when the injection happens. So
Correct.
is it a fearful thing, or is it like we take some kind of a cloth material or some kind of
Right.
cotton, rub it off? Is it
Right.
that?
Right. So, generally the way the pens and syringes are made, it's mostly for subcutaneous injection. So, if you get blood, it's going to be a small little drop. So, if it's a small little drop, please don't panic. Yeah, there is nothing to worry. It generally happens if you inject too shallow, or it happens if you remove the injection too quickly. So I generally tell people, you generally, if you're using a syringe, it's at a 45-degree angle. You take a pinch and put it right in. You generally pull it a little bit to just see if you are going to inject in the blood or is it too shallow. If you don't see anything red coming out, you can clearly inject. Once you've clearly injected, all the insulin has gone inside. Wait for a couple of seconds. Count till 5, count till 10, and then remove the syringe. There are very few chances that the blood will come out in this situation. However, some people have superficial skin, some people have more capillary permeation, and it may happen that you may get a drop of blood. As long as that is there, if it's a single drop, don't worry too much, right? Also, don't press that skin too gently after you have injected. Sometimes you may do a problem. So simple thing is, again, you just clean it with your standard cotton, hold it for 10 to 15 seconds, hold the cotton on it, don't rub it. Yeah. Don't That's a thing. Some people, will rub it like this. People have a habit, when they put Dettol, Savlon, and all that on wounds also, they keep rubbing it. But when you do it on insulin, and if you have some blood there, please don't rub it. Just press it and keep it there. If it is happening frequently, that, if it's a one-off thing, nothing to worry. But if it's happening very frequently, that 3 days in a week it has happened, or 5 days in a week it has happened, please speak to your doctor, yeah, and get it changed. Another thing, if you're probably not getting your doctor's appointment, or you have a nurse nearby, or a local clinic, you can probably go there, get it administered from a nurse, from a person who knows how to do it, and then see if the blood is coming or not. Because more often than not, it is the technique of administration because of which you are getting it, or in very rare cases, it could be for patients who have a coagulation disorder or some kind of thing where the doctor will have to intervene. So
So here, I wanted to know what are the key steps to follow while preparing for the injection in terms of hygiene, in terms of needle preparation, and in terms of air bubble removal.
correct.
So, what are the key steps, Dr. Manthan?
Correct. I think four things. First is you wash your hands. Yeah, just regular soap and water washing is fine. Second is you check your insulin. This is the most important step. You inspect your insulin. You would have seen a fresh vial. You know how it looks. So some insulins are clear, some insulins are milky, depending on their type. So it has to the clear one should look clear, the milky one should look milky. There should be no flakes and no frosting. So just see it probably in sunlight or see it behind a light, and just notice and observe if there are any flakes or frosting. This is a very, very critical step. Most people don't do it. I know most people don't do it. They just take out the insulin from the fridge, fill it, and just put it out, right? And then you land up with issues. So please check every day. Make it a habit to check. It's a total step. Following all steps will not take you more than 5 minutes if you put on a timer. And I'm sure people can spare those 5 minutes rather than getting complications. Next one is using a new needle. Now in India, we are very, very cost effective. The needles are not expensive, honestly, right? You get them in bulk. You can really get it not for something very expensive. They're quite cheap. Please use a new one. There are a lot of complications that happen. They get bent when you are injecting. You don't probably sanitize everything well. Microbes can get in, then infection happens at the injection site, or you have infected in other ways. So please try to use a new needle. Yeah, for pens, of course, if they are pens, they come in that closed form, so it's fine. If you're using needles, please use new ones for the safety of this. Fourth, I think you asked about air bubbles. So you can tap or push a few drops before injecting. Simple thing is to, if you just tap this way, the air bubbles will go away. If it's not there, you re-put it and just try and draw it again. Also, some people have a habit of using sanitizer or using antiseptic swabs every time when they are putting insulin, from that mindset that whenever there's an injection, you need to put that spirit before you put the injection. Don't overdo it. For insulin injections, regular clean washing hands and then doing at the site is fine. The second reason I'm saying this is it makes the skin dry sometimes, and overusing that, and making it dry will lead to other dermatological complications, and diabetics who are on insulin are anyway prone to a lot of dermatological complications. You don't want to add to it. Sometimes we think we are doing it for the good, but you're actually causing more harm to the patient.
So, you already spoke about this needle change and all. But
Right.
I have seen, I have talked to many people, and I was strange to know that they are changing the needle after 1 month or 2 months.
Yes.
When I heard that, I was almost like feeling very doubtful about the way they are doing it. So once again, I want to ask you, Dr.
Sure.
Manthan, you already told that.
Yes.
So what is the best way to change the needle?
Best way I will say is change every time. Yeah. People might, like I said, will not sign like it because we are not reusing it to save money. And patients come with the same excuse saying, "Oh, I'm using it only for myself." No, then what is the harm? Right? So what happens, like I told you, you sometimes what happens, reuse needles, one, they can also become blunt. Like you said, if they're using it for 1 or 2 months and changing it, they have already become blunt. So your insulin is not going in probably, right? Or they get bent, like I said. And of course they can get infected. What happens is these can also cause pain, right? These can also cause more pain when you're injecting because it's a bent needle, it's not going in, so you're trying to push it, or it's a blunt needle, so you're again further and further, which leads to again complications, lipodystrophy, and all of it also happens, more and more. If cost is a real concern, which like I said, it is generally not there with needles, you can still talk to your doctor and see what can be done, and how often or something you can do. Generally, to pacify the patients, we come with a quick fix that, okay, use it for a week or use it for 2 days, because patients are persistent sometimes, so that they want to do it that way only. But I generally say you change every time you use a needle, but most people don't listen, but change as frequently as you can. At least, don't use it for a month or 2 months, and be very careful when doing it. So it's still an injection. You are very, people are very particular. When they go to a barber, they'll be like, oh, I need a new blade. If they are getting any other injection in a hospital or nurse, they will first check, if that's a fresh syringe and needle that they've opened or not. But once you give them the same facility at home, then hota hai chalta hai, anything is fine.
Well said, doctor. As you told, and it is a fact also. The way we do insulin injection is the way we cure our diabetes, because
Correct.
we think that we are doing the correct way, but once we go and check our level of diabetes, and we see the higher figure,
Right.
and we think about several things. But the major thing is that the insulin injection is not done in the proper way, and you have told all the excellent points. So here I wanted to know, how can one recognize and prevent the concept of hypoglycemia and after an insulin injection is done, especially when adjusting doses?
Correct. So, very, very good question, because this is one of the most common complications that happen when patients are on insulin. You have to adjust doses in many ways. There are a lot of other factors that go in and can lead to hypoglycemia, which is low blood sugar. There are classical signs of low blood sugar, right? Which a lot of us know, but I'll just repeat. One is you start sweating, or you start feeling shaky or getting tremors. There's irritability. Then you may feel dizzy, or you may suddenly feel like you need to take something. You are very, very hungry. So this generally happens. We generally tell this to patients that you must, on insulin, that you carry something sweet with you wherever you go, either glucose tablets, or you carry a toffee or a small juice box or a small piece of chocolate. Now, what you can do to prevent this, right, when you are particularly trying to adjust doses? First is, if you've injected insulin, don't forget to eat. So we generally tell people that you when you the ones, at least especially when you're taking the ultra fast acting or the others, when you take them just before meals, so you take them at the dining table. I tell most people that if you have the luxury of a dining table at home, please take your insulin shot there, which gives you and reminds you that, okay, I have to eat. Right? So please don't, if you have taken insulin, please don't forget to eat. If you've forgotten to take insulin, and people do the reverse, actually, to be honest, people forget to intake insulin but never forget to eat. But sometimes, yeah, it happens. So but if you have taken insulin, please, please, please eat, don't forget. A very critical step two is, don't overdose. Patients sometimes self medicate. Yeah. They sometimes feel, a lot of patients have their own theories that, oh, I am feeling like I have high blood sugar today. This is one of the most common theories that you've got, and even when I was doing digital management of diabetes, this is what they're asking the chatbot all the time. I am feeling like I have high blood sugar. Very, very common. Yes, you cannot feel high blood sugar. You can feel low blood sugar for sure with sweating and all of that. You will generally not feel high blood sugar. So don't change the dose according to your whim and fancy. That, oh, okay. A lot of patients also have a habit that they'll do a blood report. They have an appointment with the doctor after 3-4 days. They will suddenly end up doubling their own dose, saying, "Oh, I know it's come. My insulin, my sugar has come very high. Before I meet the doctor, if something happens, let me take double." So don't overdose. That is one of the most common reasons for it. Third is exercising. This again happens, a very psychological phenomenon. The moment the patient gets prescribed insulin, after trial and error of multiple oral anti-diabetics, they feel, oh, now I have to be very vigilant about my health. So what they start doing, they take insulin at the whatever highest dose that the doctor has prescribed. They will do a strict diet control, or they will get into intermittent fasting or keto diet or whatever diet fad that they hear, and they will start exercising very heavily. Now, when they start doing all of this, you are fasting yourself a little, you are releasing more insulin by exercising, and you've taken a top up dose of insulin, which was prescribed to you, which makes it worse. So, also, my suggestion to all the patients who are listening and others also who are probably taking care of these patients is that if you are exercising, or if you plan to start heavy exercising to control your blood sugar, which is a very good thing, but please inform your doctor that you are going to do that, so he or she can give you the right dose according to your exercise regimen, right? So please inform that and see and modify those doses. If you are exercising heavily, please eat well, and then so you can take the insulin again according to the time. Or if you have an exercise routine at a fixed time, your doctor will tell you how to modify your insulin dose timings so that you are not overdosing and getting hypoglycemia, right? So and when in doubt, I tell people, sometimes you don't know what to do, less insulin is sometimes better than taking more. So less is more is a standard dictum, works here as well, because hyperglycemia has its own complications, but none of them are very life threatening. Hypoglycemia is life threatening, can cause cardiac arrest, can cause seizures, can cause fatality. So be very, very careful. We are taking it to measure blood sugar, and it's just small, errors or small lack of awareness on some side can land you in an emergency room.
So here, Dr. Manthan, I wanted to know, during the time of illness, during the time of traveling, or some people do fasting.
Correct.
So is it required to change the timings of doses,
Sure.
insulin doses?
Yeah. So, first is, I think you asked about illness, right? Now, in illness, in diabetics, particularly, what happens is your sugar spikes, even if you are not doing anything or taking anything sweet or other things, you will get it. So, you have to check your sugar more often when you are ill, and don't skip insulin if you are ill. People do very contrary things. They take less insulin if they are ill because they think they are taking other medicines and they will have interactions and all of that. No, if you are ill, you need more insulin. So you should not skip insulin, and you should keep checking your blood sugar more often. When it comes to fasting, particularly strict fasts like Ramadan, or Jainism fasts where people don't eat at all. A lot of other Hindu fasts allow you to eat fruits, allow you to eat certain things which are all high in carbohydrates, so the changes there may not be too much. But Ramadan is almost 12 hours of fasting, and a lot of other Jainism fasts are all 24 hours where they're just on water. So when you're doing any of these things, we generally uh, shift patients to a basal bolus regimen, as we call it, where they take a basal insulin to start with, and then they take another bolus insulin later. So here we generally follow that your basal doses may stay and bolus needs adjustment. But if you are going to fast, please talk to your doctor before it. Anybody who follows Ramadan, please do a routine follow up visit with your doctor before your fasting starts, so your insulin can be adjusted. Same goes with people who are, are doing other fast at a stretch. If it's a single 1 day fast, you may skip insulin on that day, right? But again, for longer durations, please get it adjusted, because you cannot skip insulin every day, even if you're fasting. So, don't go under the impression that, doctor said that if you're fasting, skip insulin. I'm fasting for 3 days, so I'm not going to take insulin even once. So please talk to your doctor and get your doses adjusted, because every type of insulin has a different regimen, different way to act. Yeah, you may be on a long acting insulin, which works for 48 hours, and you fasted in the middle of that, and that will cause complications again. So please speak to your doctor. And I think travel as well, right? So when you're traveling, you if you keep your insulin generally with you, keep it in your hand luggage. Don't check it in and keep it away in the flight or anything. Generally keep it handy. For people who travel across time zones, you may need adjustments, as in you might have to shift your doses by 1 or 2 days if you have that kind of travel, because you've left in the day here and then you've reached somewhere in the night and all of that. So you might take 1 or 2 days to adjust, so that kind of travel you may miss it. Otherwise, like I said, most insulins work well at room temperature. So if you can take them, carry them with you for your travel as well. If you've opened the vial, don't use travel as an excuse to skip insulin. But again, if you are not eating well in your travel, or if it's too strenuous, like you're trekking or hiking, etc., where your body is going to release a lot of insulin, then you may want to discuss with your doctor on how you want to take it or not take it. Uh, I'm not saying general rules, because this is very individualistic, and I don't want anybody to feel that, oh, you doctor, I heard this from a doctor there, and that's why I did this. So it's very personalized for everyone. So just talk to your doctor. Sometimes patients feel that we cannot ask the doctor these questions, but as doctors, we want you to ask these questions so we can tell you, rather than you making mistakes. So when in doubt, feel free to ask.
Exactly, Dr. Manthan. Finally, I wanted to know what are the common mistakes you observed that the people make while doing the insulin injection, and what are the best practices to avoid these kind of mistakes?
I think the common mistakes we've discussed, most of them, is just, I'm just going to probably summarize, and there are top three. Top three: first is wrong technique. Yeah, that is the most common mistake that happens. People either inject too shallow into the skin, or sometimes too deep, or don't do it. Linked and related to that is that they do it at the same site every time. Don't rotate it. You get very comfortable that I've set that angle well, so I want to inject here only. Most common. Not all of them come up with lipodystrophy, but yeah, they come up with, again, varying blood sugars. So the lumps may not be visible, but you will not get controlled blood sugar. So that, and I think the other one which we spoke at length again was about reusing their needles, which is again a very very wrong technique. So it feels cheap in the short term, but it's very very costly later. So I think best practices is, you rotate your sites, use fresh needles, check your insulin before you inject. Like I said, you check whether it is frosty, any flakes have developed, any discoloration, any texture change. Check the expiry date of your insulin, uh, right? And one more thing I think which I recommend people is to keep a small log. Nothing fancy. You probably don't need an app or anything, or maybe if you have a pen and paper habit, put a diary and write it. Probably that I took insulin at this time, and if you're measuring blood sugar before taking it or after taking it, then mention your blood sugar values also. Someday, if you have felt a symptom, just after taking insulin, or have skipped it, also just make a mental note of these things in a diary, or you can these days WhatsApp it to yourself or in your family group or wherever. It helps the doctor to understand, because you don't visit doctors very commonly when you are in diabetes, right? You have generally a month or 3 months of follow-ups, and we don't know what has happened across those 1 or 3 months, and that helps you also to keep a track, and helps us also to understand and titrate your dose better. You are able to then understand uh, how to take it, what has gone wrong, what worked, what didn't work. So simple practice is that. And another thing is just communicate, and don't follow random WhatsApp university forwards or discussions that happen in your family circle. There are tens of different types of insulin, like I told you. Everybody's regimen is personalized. So don't compare units like you compare marks. That, oh, why is somebody getting 40 units and why is somebody getting 12 units, and why is somebody taking it before meals and why is somebody taking it after meals. So don't judge others' practices. Everybody is being prescribed something by their doctor, and please follow it. If you feel that somebody else is doing otherwise, talk about it to your doctor rather than trusting a person who is not probably an expert in the field and thinking, oh, my doctor's done a mistake by telling me, or I have done a mistake by hearing it wrong, whether it was before meal or after meal. Please clarify. Trust credible sources when it comes to insulins and other things. If you don't know, when in doubt, always feel free to ask. Don't trust sources of information which are not credible. So those are best practices.
Really excellent pointers, Dr. Manthan. Whatever you have told may save so many people's life directly or indirectly. And as we say, doctor is equivalent to god in our country, so that is well proved with all your excellent pointers. Thank you so much, Dr. Manthan. Really,
Right.
if the people hear this podcast, whatever they are neglecting, taking it as a granted thing, definitely they will try to improve themselves in doing this self-administering thing. Because as you rightly told, when we go to clinic we ask 100 things, but when we are doing it on our own, we neglect everything. So really, this podcast is very educative, and I learned a lot from you. Thank you so much, Dr. Manthan, for
My
having
pleasure.
valuable
My
points.
pleasure. Thank you so much, Dr. Rajesh, for inviting me. And I hope the message reaches patients in the right spirit. And we hope to make lives better and healthier. That's all.
Thank you so much, Dr.
Thank you. Bye bye.